This is Fan Yang from MoneyWise Smart. At MoneyWise Smart, we have been investing in and acting as partial business owners of JD.com, a great e-commerce business in China, for a few years now. Personally, for me, I invested in JD.com in late 2018 at around $25 per share. I have been holding the shares since, and it has been a 3-bagger now, and was even a 4-bagger in early 2021 before the price came down. Throughout our time of owning JD.com, it has made a few spin-offs of its major subsidiaries. First, JD Health in December 2020, and next, JD Logistics in May 2021. So we decided to look into these spin-offs to strengthen our understanding of the businesses we own. We have previously covered what we learned from reading JD Logistics Global Offering document, which is about 600 pages long. So do watch that video if you haven't. And today, we will talk about the key points we have learned from reading JD Health's Global Offering document, which is equally long at about 550 pages, plus its 2020 annual report, which is about 200 pages long, and some of the filings of its competitors like Alibaba Health and Ping An Healthcare.
It takes a long time to research and prepare the video, so your support will go a long way in motivating us to produce more investments videos like this. I would really appreciate if you can help to smash that like and subscribe buttons so that more people will get to know about this video.
First, JD.com carved out JD Health International and listed it on the Hong Kong Stock Exchange in December 2020 at an IPO price of about 70 Hong Kong dollars. Its share price has then come crashing down from the Hong Kong dollars 110 closing price on the first day of listing to the 70 plus Hong Kong dollars level now, which is close to its IPO price. Before the IPO, JD.com, through its wholly owned subsidiary JD Jiankang, indirectly owned 78% of JD Health's total shares. After the IPO, JD.com remained the major shareholder, owning about 68% of JD Health at the end of 2020. Next, let's try to understand the situation of medical care in China first before we talk about the companies in this industry. As you would expect for an emerging country with more than 1 billion population, medical care in China is lacking. In 2020, for every 1,000 people, China had only 1.8 doctors compared to 2.4 in the US and 2.8 in the UK. And the doctors are unevenly weighted towards specialties instead of primary care. So there are much less family doctors in China. Specialists in Chinese hospitals are overburdened with general duties, and Chinese patients on average have to wait for 3 hours to visit a doctor for just 8 minutes of consultation for minor ailments. And hence, there are a lot of opportunities to leverage on the internet and artificial intelligence to improve the medical care situation, improving the patient's experience and lowering the cost. That's why telemedicine has been booming in China in the past few years and has been accelerated by the COVID-19 situation, with online consultations and internet or crowd hospitals on the rise. Let's watch a quick video to see things on the ground first. Now, let's look at a quick history of JD Health. It started operating as a standalone business unit within JD Group in early 2014, selling pharmaceutical and healthcare products online. 3 years later, in 2017, it launched online consultation services. Subsequently, it obtained the license to issue prescriptions online and established various centers like cardiology centers, ENT centers, traditional Chinese medicine centers, and stomatology centers. In 2020, it launched its family doctor services with health management packages catered for families, and it IPO'd in late 2020. So what does JD Health actually do? Its mission is to become the go-to health management platform for everyone in China, driven by its technology and supply chain capabilities. Basically, imagine you are a consumer in China. Whenever you have some sickness, you can pull up JD Health's mobile app to consult a doctor online. If your condition is minor one and can be resolved online, then the doctor can issue you drugs, prescriptions, including for prescription renewals, which you can receive them by delivery. For more serious conditions, you would likely be referred to offline hospitals. You can also purchase pharmaceutical and healthcare products like OTC drugs, wellness products, and medical devices on JD Health's online pharmacy, either from its direct stores, JD Pharmacy, or from its marketplace that has more than 12,000 third-party merchants. For the retail pharmacy, instead of having to visit offline pharmacies to purchase items through JD Health's online pharmacy, you get access to a wide assortment of high-quality pharmaceutical and healthcare products with 20 million SKUs that cater to all aspects of users' diverse healthcare needs. You can select the products by category, by medical or health scenarios, and you get to see all the product information, including instructions and expiry dates. And if you have any questions, you can communicate with the pharmacist or the doctor using the app with its 11 drug warehouses, plus 220 general warehouses across China and strong fulfillment capabilities. You can receive the items you purchase within 1 day or even within 30 minutes if you opt for the fast deliveries for emergency cases, where the items will be delivered from the nearest partner offline pharmacies in more than 200 cities. For the online healthcare services, JD Health offers many hospital services like online consultation and prescription renewals, chronic disease management, and family doctor service through both in-house and external doctors, and also many other consumer healthcare services like medical exams or vaccinations. All these can be done on the mobile app with user-friendly interface, and you can also find specialist doctors or very renowned doctors nationwide. And you can see their reviews and ratings before using their services. This is much more convenient than having to visit offline hospitals or clinics and waiting for hours to see the doctor, particularly if the condition is just a minor one. Basically, JD Health is trying to establish a closed-loop ecosystem and business model, with its retail pharmacy business and online healthcare services integrating with and complementing each other seamlessly. Its retail pharmacy business directs its user base to its healthcare services for online consultation and prescription renewal through offerings such as chronic disease management and family doctor service. Its online healthcare services anticipate user demand, improve user experience, and redirect the user traffic back to its retail pharmacy business for purchase of other healthcare products such as supplements and medical devices. The two businesses reinforce each other, forming a virtuous cycle and symbiotic ecosystem, generating much value for both the consumers and JD Health. Now, let's look at the market size and growth. Overall, the market is huge and growing fast, whichever way we look at it. On total healthcare expenditure, it was 7 trillion RMB in 2019, having grown at a compounded annual growth rate or CAGR of 12% from 2015 to 2019. It was projected to grow at a CAGR of 10% to 2024 and then 9% to 2030, reaching 18 trillion RMB. This high growth is mainly driven by factors like an aging population, rising per capita disposable income, increasing prevalence of chronic disease, and growing health awareness. Within the healthcare industry, digital health and wellness market is growing even faster due to the various benefits offered to the different players in the value chain, as I have explained earlier. The digital health and wellness market is still very much in its early innings. In 2019, only 2% of China's pharmaceutical products were distributed throughout hospital online retail pharmacy, and 6% of consultations were done online. But it has grown significantly in 2020 and accelerated by the outbreak of COVID-19, and growth of digitalization in one area often trigger growth in other areas too, due to the inherent interconnectedness between healthcare products and services. There are various tailwinds for online consultation and chronic disease management. One key factor is the current inefficient and unequal distribution of offline medical resources, where medical resources are overly concentrated in large hospitals in affluent cities, resulting in long waiting periods for patients, where on average, patients spend 3 hours on outpatient visits for just 8 minutes of diagnosis time. This is where online consultation would come in handy, helping to distribute the resources better and achieve a hierarchical diagnosis system in China by effectively channeling the right patients online or offline, depending on the severity and nature of the cases, therefore alleviating the current burden on China's healthcare system. In terms of numbers, the digital health and wellness market stood at 218 billion renminbi in 2019, with a digital penetration rate of 3%, and was projected to grow at a CAGR of 39% to 2024, and then at 25% to 2030. The different market subcategories have different projected growth rates. JD Health operates in most of these subcategories, although most of its revenues are coming from online retail pharmacy now. Online retail pharmacy submarket is projected to grow at 34% CAGR from 2019 to 2024, and then 18% to 2030, while online consultation submarket is projected to grow very fast from 2019 to 2024 at 77% a year, and then slowing down to 18% to 2030. This high growth is driven by the consumer's acceptance of using online services cultivated during the outbreak of COVID-19, and also driven by supportive policy environment. In terms of competitive dynamics, as the digital health and wellness market is an emerging market, there is a large number of participants focusing on different aspects of this market. And many of such participants are currently exploring various business models and tend to develop within one particular segment. However, owing to strong network of healthcare resources and supply chain capabilities, 3 key participants have developed presence across multiple subsegments through focusing on a platform model to realize synergy between different business segments. They are JD Health, which had the highest revenue in 2019 of 11 billion renminbi, followed by Alibaba Health, which had a slightly lower revenue of 10 billion renminbi, and Ping An Healthcare, which had only half the revenue at about 5 billion renminbi. In terms of online retail pharmacy submarket, JD Health was also the largest by revenue in 2019 at 30% market share, followed closely by Alibaba Health at 27%, and Ping An Healthcare was not the top 3 in this sub-segment. Let's do some comparisons of the top 3 platform brands, being JD Health, Ali Health, and Ping An Good Doctor. They were mainly established in around the same period in 2014 to 2015, and as of September 2021, JD Health had the largest market cap at about 240 billion Hong Kong dollars, followed by Alibaba Health at 170 billion Hong Kong dollars, and Ping An Healthcare being much smaller at 63 billion Hong Kong dollars. All 3 brands offer online retail pharmacy and online consultation, although there are many more standalone players too, like 360 Health and Yao123.com in online pharmacy, and more than 1,000 telehealth companies doing online consultations, including Tencent VDoctor. Online retail pharmacy revenue, including the marketplace revenue, made up most of the revenues of JD Health and Alibaba Health at 90% or more of their total revenues, but much less for Ping An Healthcare at 54%, which derive lots of revenue from online medical and healthcare services too, unlike the other 2 players. On medical insurance, Ali Health is piloting direct insurance billing with Alipay, while Ping An Good Doctor sells commercial insurance, including to more than 1,000 corporate customers in 2020. On relative sizes, although JD Health had the highest revenue in 2019, Ali Health actually was quite much bigger in online retail pharmacy in terms of gross merchandise value GMV at about 123 billion renminbi in the financial year ending March 2021, and in terms of number of SKUs at 33 million SKUs, in terms of number of third-party merchants at 23,000 merchants, and active users at 280 million users. This online retail pharmacy size is followed by JD Health, with Ping An Good Doctor far behind. On medical network, Ping An Good Doctor had the largest network with hospitals, healthcare service providers, and pharmacies, with lots more online consultations than the other 2 players, although JD Health had the most number of doctor network. On logistics, JD Health was connected to the largest network of drug warehouses, and although all 3 brands have fast delivery services that deliver drugs within 30 minutes, JD Health could do that in 300 cities, much more than the 30 to 50 cities for the other two players. So overall, we can broadly summarize the competitive dynamics as Ali Health having the largest online pharmacy in terms of operating statistics, followed by JD Health, which actually monetize it into higher revenue despite smaller operating scale. Ping An Good Doctor having the largest medical network with lots more online consultations per day than the other two players. And JD Health being strongest in logistics capabilities. Just on Ping An Good Doctor, which derives revenues from not just online retail pharmacy, but also a substantial portion from online medical and healthcare services, unlike the other two key players. We can see here that it provides many different healthcare services packages. So that's one differentiating point for Ping An Good Doctor. However, the overall digital healthcare and wellness market is very huge and growing fast. When the former CEO, Li Juanxing, was asked how does JD Health differentiate itself from competitors like Alibaba Health and Ping An Good Doctor in this very competitive space, he said that the entire Chinese healthcare industry, or the three main players, are very small. And we are all trying to change consumer behavior in light of this. We are business friends on the same mission of encouraging users to use medical services online. We are not necessarily competitors.
For the remaining points of this video, you can check them out at our multi-bagger research series. At MoneyWise Smart, we do deep dive research into wonderful companies to own for the long term. We have provided some of this research for free in our free research series. So definitely check them out at the link provided if you want to invest in good companies. I promise you will really benefit a lot from this research. If you have enjoyed this video, do hit the like button now and don't forget to subscribe and hit the notification bell so that you'll be notified of our future videos. Do also join our Facebook group where we discuss interesting investment concepts and businesses. Thank you for watching and see you in our next video.